The history of autism research has been shaped by a persistent, deeply flawed assumption that autism is a male condition. This belief has guided decades of scientific inquiry, medical diagnostics, and public awareness, leading to a system that has systematically ignored, misdiagnosed, or outright dismissed autistic girls and women. And the consequences have been profound. According to recent studies, as many as 80% of autistic females are first misdiagnosed with conditions like social anxiety, borderline personality disorder, or eating disorders before anyone considers autism. These women are not being missed because they're rare. They're being missed because the science itself has failed them. In her new book, Off the Spectrum: Why the Science of Autism Has Failed Women and Girls, cognitive neuroimaging expert Gina Rapon lays bare the structural bias embedded in autism research. Her findings are damning. Of the more than 120 studies she analyzed that aim to understand brain differences in autistic individuals, 70% included only male participants or token numbers of women. Less than 10% of the 4,000 participants across these studies were female. This is not an oversight. It's a systemic blind spot. And the result? An entire framework of diagnostic tools, tests, and clinical assumptions built around the male presentation of autism. Girls who don't behave like autistic boys simply fall through the cracks. The so-called gold standard assessments are calibrated to detect meltdowns, aggression, repetitive behaviors, and social detachment, traits more likely to present in boys. But many autistic girls manifest differently. They internalize distress, they camouflage their struggles, and they bend over backwards to fit in socially until they can't anymore. Often, they suffer in silence, misdiagnosed and misunderstood, sometimes for decades. Even leading researchers and clinicians are not immune to these biases. One example Rapon highlights is from Kevin Pelfrey, one of the top autism researchers in the world. Despite his expertise and the fact that both his children are autistic, it took years for his daughter to receive a diagnosis.
Why?
Because she was dismissed repeatedly by professionals who said she was simply shy, who promised she'd grow out of it. This is not just frustrating, it's dangerous. Misdiagnosis delays crucial support and often leads to unnecessary or even harmful treatments. The damage doesn't stop at childhood. For many women, a correct diagnosis doesn't come until adulthood, after years of confusion, mental health crises, or being labeled difficult, dramatic, or broken. When these women finally receive a diagnosis of autism, the overwhelming reaction isn't fear, it's relief. Suddenly, their lives begin to make sense. Suddenly, they aren't crazy or inadequate. They're just neurodivergent individuals who were never seen for who they truly were. What makes this oversight even more egregious is that signs of autism in girls have always been there. Back in the 1980s, Dr. Lorna Wing, a pioneer in expanding the understanding of autism, warned that girls might be better at masking their symptoms and that they were socialized from an early age to behave more appropriately in public. But her insights were largely ignored. Instead, researchers doubled down on the male-centric view, reinforcing a cycle of underdiagnosis. Girls often present as what Rapon calls chameleons. They study social interactions, mimic others, and force themselves to conform, all while experiencing tremendous inner distress. This camouflage starts as early as age 4 or 5. And while boys who act out are flagged for further evaluation, girls who shut down or withdraw are more likely to be seen as well-behaved or simply quiet. The irony is stark. We've long imagined autism as a condition marked by social disinterest, emotional aloofness, or detachment. But many autistic girls are desperate for social connection. They just don't instinctively know how to make it. They're not antisocial, they're socially deaf, as one young woman described it. They want to belong but can't decode the hidden rules that govern everyday interactions. That disconnect often leads to mental health crises, self-harm, or identity confusion, none of which are resolved by being dismissed as just anxious or just hormonal. And yet, there's still resistance to changing the system. Medical professionals continue to rely on outdated diagnostic models. Teachers still respond differently, depending on whether a child's name is Jack or Chloe. The subtle cues that might trigger concern in a boy are brushed off in girls as normal growing pains. Rapon argues that this must change, and urgently. The inclusion of sensory sensitivity in the DSM 5. TR is a step forward, but far from enough. We need diagnostic tools designed for girls, informed by the lived experiences of autistic women. We need school accommodations that account for different expressions of neurodivergence, like offering quiet spaces, sensory support, and alternative social settings. And most importantly, we need to actually listen to autistic individuals themselves. There's a growing movement toward inclusive, participatory research, where autistic people advise researchers and help shape the questions being asked. This isn't charity, it's essential science. If researchers had been listening all along, we wouldn't be in this mess. The medical establishment must also move away from defaulting to pharmaceutical interventions. While certain comorbid conditions like sleep or gastrointestinal issues need treatment, many of the so-called symptoms of autism are responses to a world that misunderstands and marginalizes neurodivergent people. These are not illnesses to be fixed. They are warning signs that the environment is failing to accommodate. We are only just beginning to understand how many autistic girls and women have been misdiagnosed, mislabeled, or simply erased. The science of autism as it stands is incomplete because it has only told half the story. It's time we tell the other half.